All you need to know about pancreatic cancer. Due to its difficulty in detection, pancreatic cancer is typically not discovered until it is far advanced. Weight loss and jaundice are indications of pancreatic cancer. Diabetes and exposure to specific chemicals are risk factors. The type of treatment needed will depend on the tumor's size, location, and whether it has spread to other parts of the body. What does a pancreas do? A tiny gland with a hockey stick form, the pancreas is situated behind the stomach. The pancreas' primary functions are to assist in food digestion and control the body's blood sugar levels. Because it produces the chemicals glucagon and insulin, which regulate blood sugar levels, the pancreas plays a role in blood sugar regulation. Pancreatic cancer. What is it? When the pancreas cells undergo modifications, mutations, the uncontrolled growth of those cells results in pancreatic cancer. The tissue might become a bulk. This tumor may occasionally be benign, not cancerous. However, the mass in pancreatic cancer is malignant cancerous. What forms of pancreatic cancer are there? Exocrine tumors and neuroendocrine tumors are the two forms of cancers that develop in the pancreas. Exocrine tumors make up roughly 93% of all pancreatic tumors, and adenocarcinoma is the most typical form of pancreatic cancer. When someone says they have pancreatic cancer, they typically mean pancreatic adenocarcinoma. Ductal adenocarcinoma is the name given to the kind that most frequently starts in the pancreatic ducts. The remaining pancreatic tumors, which make up around 7% of the total, are islet cell tumors or islet cell carcinomas, also known as neuroendocrine tumors, NETs, pancreatic NETs, PNETs, or neuroendocrine tumors. Some NETs overproduce hormones. Depending on the type of hormone the cell produces, they may go by other names. For example, an insulinoma would be a tumor in an insulin-producing cell. Who's prone to pancreatic cancer? Pancreatic cancer accounts for about 3% of all cancer cases and 7% of all cancer deaths in the U.S., according to the American Cancer Society. Men are somewhat more likely than women to experience it. Which signs and symptoms accompany pancreatic cancer? Most people don't notice pancreatic cancer's early symptoms. However, when the illness worsens, people could observe. Asterisk, back pain may radiate from the upper abdomen. Asterisk, the whites of the eyes and skin become yellow, jaundice. Asterisk, tiredness. Asterisk, decrease in appetite. Asterisk, poop with a pale hue. Asterisk, pee with a dark hue. Asterisk, loss of weight. Asterisk, body clots of blood occur. Asterisk, rough skin. Asterisk, new diabetes or deteriorating diabetes. Asterisk, nausea and diarrhea. If you exhibit certain symptoms and have recently been diagnosed with diabetes or pancreatitis, a severe condition brought on by pancreatic inflammation, your doctor may suspect pancreatic cancer. Pancreatic neuroendocrine cancer symptoms, such as jaundice or weight loss, may not be the same as those of conventional pancreatic cancer. Because some PNETs overproduce hormones, this occurs. Why does pancreatic cancer develop? There is no obvious solution. Pancreatic cancer has an unknown specific cause. However, some risk factors have been found through studies. What are the causes of pancreatic cancer risk factors? About 1 in 64 people will acquire pancreatic cancer in their lifetime. A risk factor is something that increases your likelihood of contracting a disease. Risk factors can be altered because they are a function of behavior. These kinds of risk factors for pancreatic cancer include asterisk, smoking cigars, cigarettes, and other tobacco products. Asterisk, another risk factor is obesity. Even if you do not have obesity, having excess weight around the waist is risky. Asterisk, diabetes, particularly type 2 diabetes, which is related to obesity. An indication of pancreatic cancer could be the new onset of diabetes in an older person with a normal weight or body mass index. Asterisk, being subjected to the toxins that metal workers and dry cleaners use. Asterisk, having chronic pancreatitis, a pancreatic inflammation that lasts permanently and is typically brought on by smoking and heavy alcohol consumption. Additionally, there are risk factors that you cannot alter. These consist of gene changes. Mutations are caused by hereditary chronic pancreatitis that is transferred from father to kid. Hereditary diseases include gene alterations, mutations that are transferred from parent to kid, such as the BRCA genes. Asterisk, being over 45 years old. Asterisk, being a man. Asterisk, a black person. Asterisk, identifying as having Ashkenazi Jewish ancestry. If you exhibit certain symptoms or have recently developed diabetes or pancreatitis, your doctor may suspect pancreatic cancer. The method for detecting pancreatic cancer. Early-stage pancreatic cancer is challenging to diagnose. This is because during a typical exam, medical professionals cannot feel the pancreas. Your healthcare professional may request imaging tests to obtain photographs of your inside organs if they have a suspicion that you may have pancreatic cancer. It is also possible to perform endoscopic ultrasonography. A small tube with a camera at the tip is inserted via the mouth and into the stomach to perform endoscopic ultrasonography, EUS. The pancreas can be imaged via the stomach wall using the endoscope's ultrasonic probe. During the process, a pancreatic ultrasound-guided biopsy tissue sample may be taken, if necessary. A tumor marker is a chemical that can be found by a blood test. High concentrations of carbohydrate antigen say 19-9, a type of protein secreted by pancreatic cancer cells, may signify a tumor in cases of pancreatic cancer. Everyone who has just been diagnosed with pancreatic cancer should speak with their doctor about genetic testing and counseling to see whether there is a hereditary component to their diagnosis. This is based on guidelines from the National Comprehensive Cancer Network, NCCN, and the American Society of Clinical Oncology, two of the biggest cancer organizations, ASCO. How far along is pancreatic cancer? There are 5 stages in all of the pancreatic cancer. The extent of cancer spread, the size and location of the tumor, and other factors all affect your diagnosis. Stage 0, also referred to as carcinoma in situ. This stage is marked by abnormal cells in the pancreatic lining. The cells might develop into malignant tissue and spread there. In the pancreas at stage 1, there is a tumor. Stage 2, the pancreatic tumor has either spread to surrounding lymph nodes, tissues, or organs. Stage 3, near the pancreas, cancer has spread to significant blood arteries. It might have also affected lymph nodes close by. Stage 4, pancreatic cancer that has migrated to distant organs like the liver, lungs, or abdominal cavity is considered to be in this stage. Organs, tissues, or lymph nodes close to the pancreas may have been affected. Make sure to discuss your case with your physician. You can choose your treatment more wisely if you are aware of your pancreatic cancer prognosis. The way that pancreatic cancer is handled. Treatment for pancreatic cancer is based on several factors, including the location of the tumor, its stage, your overall health, and if the disease has progressed outside of the pancreas. Options for treatment include surgical removal, the resection of the pancreas malignant portion. It's also possible to remove lymph nodes close to the pancreas. A pancreatectomy is a medical procedure used to remove all or part of the pancreas. Your doctor might advise the Whipple procedure if your tumor is in the head of the pancreas, which is its largest region and is situated closest to the small intestine. The pancreatic head, the duodenum, the first section of the small intestine, the gallbladder, a section of the bile duct, and adjacent lymph nodes are all removed during this surgical procedure. High-speed energy is utilized in radiation therapy to eliminate cancer cells. Chemotherapy. This process employs medicines that destroy cancer cells. Immunotherapy, a therapy to support your body's defenses against cancer. About 1% of patients with pancreatic cancer and a certain genetic mutation may benefit from immunotherapy, even though it has been mainly ineffective against pancreatic cancer. Targeted therapy, aimed at targeting specific genes or proteins that support the growth of cancer. Usually, genetic testing is how we decide if targeted therapy is the best option for you. Clinical trials, find out if taking part in a clinical trial is an option by speaking with your healthcare practitioner. How may pancreatic cancer be avoided? It is challenging to know how to prevent pancreatic cancer because we don't know what causes it in reality. To get healthier, you can alter your regular behaviors. These recommendations could lower your chance of developing pancreatic cancer. Asterisk, avoid smoking. Try to stop smoking or using tobacco if you already do. Asterisk, by eating well and exercising, try to achieve and maintain a healthy weight. Asterisk, drink alcohol in moderation or refrain from doing so. Asterisk, attempt to avert developing diabetes. Manage your blood sugar levels if you have them. Asterisk, if your job requires you to be around pollutants, use protective gear. If you like this video, follow us and you will find many videos that will help you to transform your life. Thanks for watching all the video. Please subscribe and hit the bell. See you soon.